Welcome everybody to your trusted platform where we have conversations that protect not just your voice but also your vision. And today we will be talking about something many people overlook because quite simply you can't feel it happening. And sometimes we can say that our eyes may feel completely fine. You may feel that you see clearly. It seems nothing is wrong. But deep inside the eyes, silent damage could already be taking place. And our focus this morning is why eye pressure and visual feed why eye pressure and visual field tests matter in glaucoma. And I'm sure many times on this program you might have listened to the guests talk about, eye pressure, low eye pressure, we lower it, we do one of two things on all of that. So today we are discussing why eye pressure and visual field test matter in glaucoma. Now let me break it down, okay? So we all have a brief understanding of what we'll be talking about today. Eye pressure, also known as intraocular pressure, is one of the biggest risk factors of glaucoma. And visual field testing, that is what doctors detect vision, that is what help doctors to detect vision loss, because here's the truth: glaucoma doesn't usually start with pains. It begins it doesn't just come as full blindness. It quietly steals your vision gradually, the side vision gradually, until it is too late to reverse. And that's why these tests are not just routine, they are life-saving for your sight. And to help us in this discussion, which is why eye pressure and visual field tests matter in glaucoma, we have Professor Nkiru Kizo Akariwe. She is a consultant ophthalmologist, ISUT Teaching Hospital, Parkland, Enugu, and the governor representing Africa World Glaucoma Association Board of Governors. Good morning, ma'am, and good to have you on the program.
Good morning. I'm glad to be here.
Right. Let's start with the basic, like we always do, because some persons probably will be listening to us for the very first time. And just so you know, this program is championed by the Eye Specialist Hospital Tesh, as well as a solid 100.9 FM, and it comes your way every Fridays, 9 a.m. till 10 a.m. So, ma'am, once again, what is glaucoma?
Thank you very much, Chibuke. And good morning again, dear listeners. It's wonderful to be back on the airwaves discussing glaucoma again. And once again, we want to appreciate the management of the Solid FM for this opportunity and this great service that they are doing to our people and to all those who actually log in online, to tune in online, to watch or listen to these episodes. And we want to say thank you for this public enlightenment platform, because it's a great one and can save people from blindness, irreversible blindness. So talking about glaucoma is actually the lead cause of irreversible blindness worldwide. And so many of us listening would have heard about cataracts. Cataracts, it's the leading cause of blindness worldwide. But cataracts, if cataract causes blindness, the blindness is reversible through surgery. But glaucoma is the second commonest cause of blindness, but the leading cause of irreversible blindness.
So it's the senior brother of cataract
when it comes to irreversible blindness, So, and that's why we talk about it a lot. And much more why we talk about it is because it blinds somebody silently. And so the person who has it does not know that they have glaucoma.
You talked about you talked about leading cause of irreversible blindness.
Yes.
Are there other things that cause irreversible blindness?
Yes, there are other things that cause irreversible blindness. There's diabetes. There is age-related macular degeneration. So there are other things that lead to irreversible blindness. Okay, but retinal detachment, but glaucoma leads them all.
Okay.
All right, and our question is, what is glaucoma? Glaucoma is actually a group of diseases that have a characteristic manner in which they present. This group of diseases, there's damage of the nerve for vision, which we call the optic nerve. And that damage to the optic nerve is a gradual but progressive. So it's a gradual, continuous damage to the optic nerve. And as I said, optic nerve is the nerve for vision. And it has a characteristic way in which it causes that damage, and also has a characteristic appearance on the visual field, which we're going to talk more about.
All right.
So we'll talk more about what the visual field is. Now, like you mentioned earlier, the eye pressure is a main risk factor for developing glaucoma, raised eye pressure.
All right. So you've talked about the eye pressure. Now let's dive into it properly. Let's start with the basics. Okay. Yes, we know what pressure is. We know what eye is. Now, if you combine both of them together, what exactly is eye pressure, and why is it important in maintaining healthy vision?
All right. It's now the eye pressure is just the way we have blood pressure. Okay, so the eye has its own pressure, which is separate from the blood pressure, the pressure of the body. Okay, just like the brain also has its own pressure inside, which is separate from the pressure of the body. Now, the eye pressure helps the eye to maintain its shape and its shape. If the eye pressure should, for instance, reduce terribly, or something causes the fluid inside to leak out, the eye will kind of like shrink a bit. Now, and if the pressure within the eye is too high, it actually causes the eye to stretch out and become bigger. But that is what you see in children when they are still newborn, up to 2 years. If the pressure in the eye is raised, it causes the eye to stretch out, and we call it ophthalmos. But after 2 years, the structures of the eye become tough and inelastic. So they no more stretch. So when the pressure increases inside the eye, it has to look for a way to express itself, because the outside covering of the eyeball is no more elastic. It won't stretch. So, and the only weak point in that whole covering is at the point where the nerve leaves the eye. Okay, so that tough covering of the eyeball had to perforate to allow the nerves to pass through out of the eye to the brain. So because of all that perforation, that's the weak point in the whole strong covering of the eyeball. And because of that, that pressure goes to push there and exerts itself, like, I need to express myself. If you have a football or a balloon and the pressure inside is too much, it bursts.
Yes.
Okay, so but because the covering of the eyeball is very tough, it doesn't burst like that. So because there's that weak point, it pushes at that point, trying to release the pressure from inside the eye. And this pressure is applying at that point, gradually damages those nerves. So it's like, so you press, you press and you starve that area of nerve, of blood supply, oxygen, everything gradually dies.
And is it at that point that it becomes very dangerous?
Yes, it's at that point the pressure, at that point the nerves gradually die. The flow, there are certain fluid that flow to the brain, from the brain to the nerves, and from the nerves back to the brain. They can't also, and all those fluids that flow nourish the nerves. Then they can't flow anymore. So gradually, the nerves are starved, and the nerves die.
And how does this now lead to glaucoma?
So the death of the nerves leads to is the glaucoma. So the death of eye nerves is what we call glaucoma.
Okay, while you explain, I was just thinking now, okay, can someone that have normal eye pressure and still have glaucoma? Is it possible?
Yes, it's possible.
Huh?
It's possible, and I'll just give you maybe two explanations that can help you understand that.
Okay, please.
Now, there are people who basically their own eye pressure is low. Now, before you say, oh, normal, for instance, we are used to normal blood pressure is between this and this. Okay, it's because some studies had been done, and you find what we call the 95th percentile. What that means is you take the middle 95% of people who are considered normal, you take them, and that's the range. So this is the lowest range of normal, this is the highest range of normal. But there are these 5% who are outside that 95%. There's this 2.5% that will be below normal, and there are also some 2.5% that will be above normal. So in glaucoma, when it comes to the eye, so there are people, we say the normal eye pressure is between 10 and 21, but there are people whose normal eye pressure is 7. So, and their eyes are used to that. That's normal for them. Okay, so just the way we say normal blood pressure is between 100 and 139 for systolic, but there are people whose normal blood pressure is 90, 95. That's what they have had, and it sustains them. It's normal for them. So when somebody who is 7, now their eye pressure increases to 15, and you are seeing that person in the clinic, and it's 15. 15 is within the normal range.
But for them, it is.
But for them, it's double what is their normal. Are you with me?
Yeah.
So and so for you, you don't know what it was before. You will say, well, it's normal tension glaucoma, and assuming the person was even your patient before, and you knew, oh, this person used to have 7, now the person is having 15, 16, 17.
That's high.
So you know that this has become risky for this eye. You will still term it normal tension glaucoma because it's within the normal range.
But for that person,
for that person it's high.
So this high pressure, is it something that people can feel or notice?
No, they cannot feel or notice it.
These changes, they can't feel or notice it?
Not at all. And that's why we say you need to go and check. So as you are now, you it's good to know what is your own normal. So you can have your...
Everybody needs to know their own normal.
Everybody know your own normal.
Wow.
Okay. And then apart from the normal, the pressures themselves, there are also a set of people that have issues with blood supply to the nerve.
Okay.
Normally, because the blood supply is not the same all the time, but the body has a way of regulating it. It's called an auto-regulation. So the body balances when supply is much, when it is low. It's like a stabilizer, to maintain a certain level. So like the way some people, you buy freezer or fridge, you put a stabilizer, so if the current is low, it brings it up to the good level. If it's too high, it stabilizes it. So the body has some regulation, or we call it auto-regulation, vascular auto-regulation, like that helps the eye and the body to balance things. All right, so some people have problem with their stabilizer internally. So they are unable to balance and regulate supply. And such persons, so sometimes they are unable to have good supply of blood to the nerve, and the nerves begin to die. A number of such persons, when you touch them, their hands are cold. Yeah.
Some people say that's how their life is.
To them it is normal, but it is a problem of autovascular regulation. But they might not know, because they are not having any problem. Yeah, some they have they feel certain their extremities, legs, hands get cold. Okay, people who also have migraines
all the time,
headaches, are also prone to that type of problem. Okay, and also people who when if they run, particularly if you do exercise, they have terrible pains, like in their calf muscles and all that. Those are just some signs of people who have some issues with their regulation, vascular regulation.
Okay, just to deviate a little, sometimes when I have health discussions like this, I begin to ask myself, what did they teach us in school? Like, there are some things you hear and you not even understand. But then moving forward, let's talk about, we have talked about what this eye pressure is all about, and how it relates with how it leads to glaucoma. Let's try to understand its testing, because it's also very important. What is the one, should I say, the procedure of testing for the eye pressure?
Okay. Yes, there are instruments we use, different instruments we use in testing for eye pressure.
Okay.
And
just tell us the common ones.
Well, they are all called tonometers. Tonometers, yes.
Okay.
And they are tonometers that are non-contact, so they don't touch your eyes, but they use something like air to check it. There are some tonometers that touch the eyes. Okay, but the gold standard tonometer actually touches the eye. So but usually if it's going to touch the eye is anesthetized. There's some drops to make to feel it is put inside. So and then the instrument is just a small touch. It doesn't hurt, it doesn't pain. That is used to check the pressure. So but it's so important that if at any time you go to see the eye doctor, even if, for instance, your eyes are itching you, there's something you can't read, tiny prints, and you just get you bet you went to see the eye doctor. Please always ask, what is my eye pressure? It's your opportunity to know. It's like reaching a hospital and you don't know what your blood pressure is. It's your opportunity. If you don't have equipment to check it at home, and you reach the hospital, it's not easy to reach.
Just as how we have this equipment of checking blood pressure at home, is there equipment of checking eye pressure at home?
There are, but they are very expensive.
Eye matter, they're very delicate.
I tell you, they are very expensive and not commonly available in this part of the world.
Oh, yeah. Okay. We often talk. You all come here and talk about visual field testing.
Yes.
What is it, and what part of the vision does it assess?
All right. Now, we want to ask somebody listening may want to understand what is visual field, and we said in the explanation of what glaucoma is, we said that this group of diseases called glaucoma, that they have a characteristic visual field pattern. In other words, they have a common way they all look like. they all affect the visual field. So when you see it, you say, no, this is glaucoma. Okay, so but you might not know which type of glaucoma it is, but you say this is glaucoma. So what is visual field? The visual field is like what you can see in a sea of darkness. So like my back is dark to me. I can't see, so it's dark to me. So but what I can see, the extent I can see, looking straight ahead, superiorly, inferiorly, sideways, that is my visual field.
Okay. What we can
so
see.
Looking straight ahead, what I can see sideways, up and down, looking straight ahead, not
bending my head,
or turning my eyes.
So we should just keep our face straight and
look. No, and you're not turning your eyes, you're looking straight ahead.
Okay.
And you're checking how far you can see by your
so
side,
that's the visual
how
field.
far you can see superiorly and inferiorly, while looking straight ahead. That is your visual field. So these tests check the visual field and usually checks one eye at a time. Okay, so now the glaucoma damages the visual, shows up as it damages the nerves. Remember, it's the nerves that enable you to see what you see in your field. So as the nerves are damaged, because there's a characteristic way that glaucoma damages the nerves, there's also a characteristic way that you see blackness in the visual field. But usually for glaucoma, the darkness starts at the periphery, so at the sides. So at the sides, superiorly and inferiorly especially. And so the people who it's affecting, they don't notice it.
Because they just turn their neck and they'll say, I'm seeing it.
Yes. So as long as you look at that object, you're seeing it. But gradually the field is reducing in size, in how far it is, how wide it is. It's gradually closing up, but you're still seeing well. So somebody can have 6/6 vision and 80% of their field is gone. And they are not aware. Because they are still seeing your face clearly. They are still seeing the board, they are still seeing the TV clearly, and it continues like that until one day the person will say, I just woke up and I stopped seeing. And it's not because it happened suddenly. It's been gradual, but they didn't know. Okay, so if you wake up tomorrow, and I want to add, God forbid, and your superior field is gone, or your inferior field, there's darkness there, you will notice it, because it's an acute thing. You will notice that something is not right. It looks like I'm not seeing something. There are people who will come and tell you, I can see something like a dark cloud coming down on my field, on my view. Okay? And that happens, for instance, in retinal detachment. I mentioned it at the beginning. But that's a sudden visual loss. So they notice it. But when it's a gradual thing like you will have in glaucoma, it's small, a little, but it's continuous. A little, the brain adjusts to it. Adjusts to the new dimensions as the normal. And then it adjusts again as the new normal. And so you, the person having it, you don't notice that something is getting closed down. So that's what the visual field is. So there are machines called visual field analyzers that are used to check the visual field. So it is the damage to the visual field that causes someone with glaucoma if they are driving, they jam things by their side and they didn't see it. And so when say, Oga, why did you jam me? He turns, or he just says why, and he turns. He said,
but I was looking now.
He said, I was looking. But I didn't see you. Where did you come out from? He said, but I've been here. And the man, so there's that argument. And the man said, but I didn't see you. So because that object, that other person is in their side view that is gone. One day I had a patient in the clinic, and I told him that one of your eyes it's almost completely damaged from glaucoma. The other one is still early.
Wait, it doesn't move at the same rate?
If you're fortunate, it doesn't move for most people.
Wow.
Yeah. But for quite a number, it moves almost together, but it doesn't have to. So I said the other one is still early. This one is far gone. He didn't believe me. Do you get? It's like, no, but I see well now. I said there's no problem. Just can you go and do your visual field and come back with the results? So he went and he came back with the results. So that eye that was advanced glaucoma had what we call tunnel vision. Tunnel vision is just like everything had closed down. It's just remaining like looking through a little hole. The rest is gone for that eye. I told you each eye is tested separately. Now most people that have these issues, because the other eye is seeing well, they don't even notice one eye is going. So when then the other eye, the field was practically full. So I showed him, I said, you see this eye? I said, anything on this side of your vision, you'll be jamming it if you're driving. He said, how did you know? So the man asked me, how did you know that? Because that is what has been happening to me. I said, it's not witchcraft. see your visual field now. See, everything here is black.
Wow.
The only light is in the middle, center, small area. That's what you're seeing with this side. So everything, any objects on this side of your left side of your eye is in darkness. You won't see it. So that was when he believed that something, and he saw the difference between that left eye and the right eye. That was when he believed that something was wrong. So you could actually be seeing very well, and yet the eye is 70% damaged, 80% damaged, 90% damaged. So it's important to have those tests done.
Very, very important to have those tests done. Well, ladies and gentlemen, if you're listening, yes, it is Glaucoma on Radio, right here on Solid 100.9 FM, and this program championed by the Eye Specialist Hospital Tesh, Enugu State, as well as a Solid 100.9 FM, and we are discussing why eye pressure and visual field test matters in glaucoma. And in the studio this morning, we've got Professor Nkirukizo Akariwe. She is a consultant ophthalmologist, Isut Teaching Hospital, Park Lane, Enugu, as well as a governor representing Africa World Glaucoma Association Board of Governors, right here in the studio. We have been talking. We have been able to establish the fact what glaucoma is all about. We have understood what eye pressure is all about. We have talked about how eye pressure can lead to glaucoma, and we have just finished discussing the visual field testing. Right now, let's get to open up the phone lines and take your calls. If you've got questions to ask, feel free to call us and ask your questions. The numbers are 0704 550 2840, 0909 771 1009, and you can also call 0902 311 1009. So feel free call us and join the conversation while we continue to have our discussions right here in the studio. So once again, 0704 550 2840, 0909 771 1009, and you can also call 0902 311 1009. Hello, good morning to you.
Yeah, good morning.
Yes, good morning.
Yeah, my name is James.
Your name is what?
James.
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 Okay, better. Good to have you, James.
Yeah. Okay. So I would like good morning speakers in the studio. I would like to ask mine is get because I was got hit by a soldier on the left hand.
James, can you speak up and sit up, please, so we can hear you properly?
Can you hear me now?
Better.
Okay, mine is retinal detachment, but the only on the left eye. Okay, the doctor told me that there's nothing they can do with the left, but I can see with the right eye, but not just don't it. And most times, only in the morning, at night I can see. So the doctor told me that the right eye that they can rectify, and they can do that. The left eye is sleeping, I don't know, but they can do it. I don't know how to ask. Is it possible? Is it true?
Is it true that?
Is it true that what?
That it could be rectified, like the left eye, I can do something about it. But I can see, but blood, like, mostly in the morning, that's what I can see. But I can't read it, but I could manage it something.
That's the eye that has the retinal detachment?
Yes, look, the left eye, the left eye is gone completely sharp.
Okay.
Right
Okay, you're talking about the right eye now. He's talking about
James,
the right
is it
eye.
about the right eye that you are asking if something can be done? James has dropped the call, but probably
okay, so I can take that.
The right eye.
Yes,
But hold on, let's add this call. Hello, good morning.
Hello, good morning, James.
Yes, good morning.
My name is Mark Oscar from Anambra State.
Good to have you, Mark.
I just want to ask a quick question. What are the factors that can increase eye pressure from normal to abnormal? For instance, rubbing of the eyes constantly is a factor and then affects the eye pressure. What about screening the eye? Now, there was one thing I encountered in the hands of a soldier one time when I was traveling. I was driving, and somehow I was asked to park. And after the argument, I was asked to, out of annoyance, they said I should go and lie down, and they'll be looking into the sun directly.
Wow.
I won't do that. It was a heated argument, and thank God people came around. I said, this particular punishment, I didn't commit any offense, so I was driving, and a car tried to overtake me. So I just stopped, and then maybe probably caused a ghost because the way you overtake me was wrong. I was not like, you don't need to overtake me, look at the junction, and look at the way I was asked to, follow the lane. So the man said I was the one that caused the problem. And then the punishment was like I should be looking under the sun directly. So looking under the sun is not going to keep my eye pressure from abnormal to being double abnormal. I mean, it was wrong. So these factors, do they actually cause abnormal pressure of the eye? Thank you.
All right, Mark Oscar, thank you very much, Doc.
Okay, thank you very much. Let me start with the question of James.
Yeah.
James had an RD on the left eye and poor vision, from what he said, not too sharp vision on the right.
Yeah.
Now, RD is that's retinal detachment, and usually is an emergency when it occurs. It's the thing I talked about that might give you feel like some black curtain is covering your field. It's an emergency. When it happens, it needs to be done immediately to save the vision. Okay. Then so obviously if you didn't have opportunity to have that done when it happens, then it's difficult to recover vision after it has stayed for some weeks. Now the other eye, so we are not talking about that left one. The right eye is, as it is now, the only eye. So it's people say that the person with one eye is like in the land of the blind. So it's just to say that you need to be more careful than other people, so you won't be careless over your eye when it's an only eye. So many people who have retinal detachment often have what we call a predisposing lesion on the other eye. What that means is that there's something in the eye that predisposes somebody to developing that retinal detachment. If it is found early, it is treated with a simple laser, and it blocks
And
that condition
if it is found early.
if it found early. So anybody who's had retinal detachment before must see the eye specialist every minimum of once in 6 months, to just have a thorough look and make sure there's no predisposing lesion that has developed that might lead to retinal detachment. Now, when you develop retinal detachment, the treatment for it is very expensive. Remember, it's an emergency. So you won't even have time to go and sell your land.
Wow. That
so
quick?
Yeah, so you need to do it immediately, and the treatment for it costs millions. So you would rather have it detected
Early.
when it is still a predisposing lesion, and it is treated with laser, than allowing it get to retinal detachment. So I want to advise James that he can have his eyes checked. Please, he shouldn't sit down in his house. He can either come to Parkland, we have a retina surgeon there, or come to the eye specialist hospital. There's also a retina surgeon there, okay? And have his eyes checked, whichever one he can afford, and have his eyes checked, the other one, so that if there's anything there, it can be tackled early. Okay?
And to the question of Mark Oscar.
Yes. About what factors increase eye pressure.
Yeah.
Now, if you drink water, a lot of water, a lot of drink, beer, minerals, anything, plenty, within a short time, it raises eye pressure. Yes.
So people that are tipsy and high, their eye pressure has increased at that point, or what? Or is it some kind of, I just want to know, because there's some days I want to go and feel alright. You understand? Once I do like that, my eye pressure has increased, or what?
No, if you drink plenty within a few minutes. Okay, let me explain it better. Like some people, we say it's important to do water therapy. So somebody, because people don't like drinking water, they wake up first thing in the morning, they take water, put their mouths in it, they don't remove it, they drink it, until the bottle empties. Then they take, maybe assuming you're told to take a liter of water in the morning, and they drink that liter of water within the space of 5 minutes, because they want to get it done with. It shoots up the blood pressure. It also shoots up the eye pressure. So within an hour and a half, the pressure will come back.
Is that
down.
why they say don't eat, don't drink if you want to go and check your blood pressure? It also affect the eye pressure too as well?
Yes, if you take a large volume, it does. So you just drink it easy. Just sip it, drink it over a period, not just once to get over with. Now, also, if you put pressure on the eye, it will increase the eye pressure. Okay?
Put pressure on the eye, like with what activity?
No, like pressing on it.
Okay.
Like pressing on it. It increases the sometimes.
So that's scratching too, does it?
If it scratching ordinary wouldn't, unless you're applying pressure. Some people, scratching is so bad. They really rub it as if, yes. So, and in so doing, they apply pressure. But otherwise, if there's no pressure, that is just a surface scratching, it wouldn't raise pressure.
And looking at the sun?
No, looking at the sun doesn't raise the eye pressure.
Oh, it's bad on its own.
Yes, but it's bad on its own. Yeah. So if you sometimes when sleeping, people don't know, they apply pressure on the eyeball. Sometimes you might wake up in the morning and when you wake up, you feel that like you've pressed one eye while sleeping, and the eye is blurry and a little uncomfortable, a little painful, and then after it eases off. We found out that when the side of the eye you sleep on, assuming you usually sleep on your right side,
yeah.
if you're going to have glaucoma, it will be worse on that side. So if, for instance, you one eye, assuming the right eye is gone from glaucoma, or like the Oscar James that said his left eye is gone, he can as well be sleeping on his left side.
So it doesn't affect the right.
So that the eye is spared any issues. Yeah.
Okay. Okay, the phone lines are still open. 0704550280, 0909-771-1009, and yes, you can also call 0902-311-1009. James Oscar, I'm sure you are satisfied with the answer given by Prof this morning. But you always talk about early detection, and whenever I hear those things, I sometimes think about Nigeria, because when we watch movies, or us that have relatives outside the country, they are very intentional about caring for their eyes, where you get to see a child of, let's say, 3 years, 5 years already using glasses and already knowing what is happening with his or her eyes. But in this side of the world, you don't, like, is it that our people are not knowledgeable about it, or they just don't care, or they just don't want to even do anything about it until things start getting worse? Because just like you said, all these things are gradual development. Most of them don't just happen over time. It happens like over the period of time. So is it because we are not intentional about the care for our eye, based on the fact that we don't have knowledge about it? Because if you don't know about something, you don't know about it. Is it about lack of knowledge, or the unwillingness of our people to want to know about these things?
Thank you very much. It's actually a bouquet of factors. Because it's not just one thing. There's systemic failure. In the developed world, a hospital tracks the children born there.
Yeah.
Okay, so they track, and when this there are some early tests done for children when they are born, and there are those who are suspected to have some predisposing lesions or factors for some conditions. So the hospital will get to you to say it's time for your
contact
checkup.
The person.
Yes, and they'll tell you it's time for your checkup. But still, it's still your duty to go. And if you don't go, you will still be sent a reminder at some other time. So it's and then because for them they also have a working health insurance scheme that it makes it easier to access health care. But here most of the population pay out of pocket. Paying out of pocket for healthcare services is very expensive. And it's not sustainable. But that's what we have here. So when you combine that with the ignorance of our people, who feel that
they're in the hand of God.
Yes, I do feel that
village people.
Nothing is wrong with me. I'm seeing very well. So you say go for checkup. So you what we are doing is to educate and you educate to change attitude. When attitude is changed, then it gets to a practice change, a change in habits. But if somebody doesn't have education, information, the attitude doesn't even change. Now and for you to have attitudinal change, that education must be consistent, before the attitude changes. So we've been at this glaucoma thing, for instance, for over a year now, or thereabout, and except somebody listens consistently or believes you when they hear you once. It's important to have your eyes checked. So it's one thing they believe you. It's important to. It's another thing to go
and have
the eyes checked. So it's a combination of different factors, and even like I've mentioned before, some projects we did sometime using the main market as an example, where we took the eye care, because some people say, I don't have time, then you take it to them, but then we said pay a little token to have your eyes checked there. So the team that went there, they had all the facilities to check the pressure, capture the inside of the eye, the nerve, what it looks like, and all that, and then transmit it by tele-ophthalmology through upload it, and the doctor where he is looks at it and say, okay, this eye is good, this one, it looks like glaucoma, that person should go to the clinic. So to make it easier, it saves you costs. You're not doing transport to the clinic to go and check. It saves you time.
That's very kind of you.
Yes, it saves you time. You're right there in your market shop. You're not losing your customers. And it's a short thing. Bam, bam, bam. Pay 1,500. Excuse me, what is 1,005? I said, I beg.
Money for beer.
He says, I beg, nothing is wrong with my eye. Are you with me?
Yeah.
So that is lack of knowledge. And even when you explain to them, look, there might be something you don't know. Is there nothing is wrong with me?
I'll take eye drop and it's over.
So we have until the education is massive, coming from different quarters and different stakeholders. We might not have the attitudinal change that will translate into a practice change.
All right, let's just see if we can squeeze in just one more call time. Not our friend. Let's see. 0704550280. Hello, good morning.
Hello, good morning, sir.
Yes, good morning.
How work, sir?
Very fine. What's your name?
My name is Peter, calling from Enugu.
Welcome, Peter.
Okay. So, if somebody wants to see her, where can he get the office?
Okay, to visit the Tesh.
Yes.
Okay, just keep listening, Peter. We'll tell you before the end of the program, okay? Just keep listening, Peter. Prof, before we wrap up, okay, we've talked about these two tests, that is the eye pressure on, as well as the visual field testing. Now, when someone goes for, these checkups and all that, is it important to combine the eye pressure check with the visual field testing, and can we just say I want to do one and I'll leave the other one? Is that how it's done?
Yeah. Two first most important ones is one, the eye pressure, and then what we call the eye examination, the ocular examination by the doctor. Okay, so the doctor looks into the eye to look at the nerve. Okay, and remember, it's that nerve head that is being destroyed.
Yeah.
So the doctor looks at it to see if there's any problem, if it's looking normal, if it's looking like glaucoma has started, and then also checks the pressure. So those are the two minimum tests that should be done.
Okay.
Minimum. But the other test that could be done, there's also a test that we call pachymetry, which we didn't talk about today, that helps you to know whether some other risk factor that is involved in glaucoma and developing glaucoma, and it also tells you whether those pressures you're seeing are falsely low or falsely high. And then there's also another test which we call the OCT. The OCT is a test that is like the CT scan or MRI of the eye. So it shows you the nerves. If there's damage to the nerves themselves, it shows you. Because it takes time before it shows up on the visual field. Actually, it takes time before the visual field shows damage. It might reach up to 3-4 years from the time it started. But the OCT will pick it earlier than the visual field. But the OCT is more expensive, so we say do the visual field at least first of all.
And just to wrap things up, the reason why people don't go for this early testing, is it fear, is it cost, or is it lack of awareness?
All of them, all of the above.
So it's expensive?
Well, it's not. Sincerely, it's not. And then apart from, we do a lot of free eye screening. So if it was just cost, say somebody will now at least
wait for when it's free eye screening.
Exactly, and
so that's why you need to be listening.
Yes.
Is there any free eye screening coming up soon?
In October. Usually there's World Sight Day in October. So there would be a free screening at that time.
All right. Well, ladies and gentlemen, thank you very much. Just before we wrap things up, I just have a few things to say. Having listened and having stayed with us through this program today, you may feel that yes, you are fine and you are seeing clearly, but glaucoma, as we have always said, does not announce itself. It works quietly, slowly damage your vision from the inside. By the time you notice, the damage is often permanent, but it doesn't have to get there. Okay, simply testing, like checking your eye pressure and your visual field, can help detect problems early and save your sight. So don't wait for the symptoms. Okay, don't assume that everything is fine. Make regular eye examination your priority, especially if you are above 40 or have a family history of glaucoma, because when it comes to vision, early detection is everything. And for our friend that called asking for where to go, just like Prof said, you can come to the Eye Specialist Hospital. It is at number 11 Churchview Ekulu West, GRA Enugu, behind a former adoration ground. Okay, 11 Churchview Ekulu West, GRA Enugu. Okay, so yes, that's where the Eye Specialist Hospital is. And if you want to call and ask more questions and know more or get directions, call the number 0809 700 2020. Once again, 0809 700 2020. Or you can call 0809 036 00. Okay, so these are the numbers for you to reach out to be reach out and speak to someone from the Eye Specialist Hospital. Once again, 0809 700 2020. Prof, thank you very much. All right, the program Glaucoma on Radio would come back again, same time, same station, next week Friday, 9 to 10 a.m. Do have yourself a blessed weekend.